might be giving your baby a lot of food and you're not combining those foods well. You're not taking care of their mediums, you're not taking care of the interaction, so they might not be able to utilize that food, so they might actually be struggling with malnutrition even with adequate supply of food. Hi guys, how are you? So children below 5 years are at a higher risk of malnutrition because of poor dietary practices, the increased nutrient demands to support growth and development. There's also the limited stomach capacity of babies, and of course there's the misinformation and ignorance from caregivers and parents. And that is why, as a registered dietitian, I've decided to create this video so that we can talk about the early warning signs of malnutrition as well as how to actually stop them before the detrimental effects of malnutrition affects your baby. One of the negative impacts of malnutrition in children is basically the slow development and growth. Like basically they achieve milestones later as compared to their peers. There's also the cognitive impairment that affects learning. There's also the emotional distraction with increased mental disorders later on in life. And malnutrition in children has also been associated with other metabolic disorders like diabetes, maybe some other types of cancers, and many other conditions like obesity and such and such. So as I mentioned, what are the early warning signs that you need to look out for as a parent or a caregiver to be able to actually understand or even curb the malnutrition before the impacts become permanent? The first sign of malnutrition in children is basically weight loss or inability to gain weight for those children who are below 12 months. During infancy, that is basically between 0 to 6 months, your child is supposed to be gaining weight every appointment, or they are supposed to not be losing any. The other warning sign that you can actually look out for is visible signs of fatigue, general weaknesses, like your baby looks dull, they look not happy, they are not interested in things that they were interested in before. This actually means that your baby is not getting enough supply from what you're giving. If it is breast milk, if it is food, or a combination of both, you're not actually meeting up the body's demands. Because as a parent or as a caregiver, I assume that you understand how your baby usually is. So if you come home and you notice they are moody, they are lethargic, they don't have energy to do anything that usually excites them, then that is a direct sign that something might be happening. They can be suffering from either an infection, they might be having limited nutrient supply, or they might be having some psychosocial or mental disturbances. So as a parent, do not ignore such things. Another common sign of malnutrition that parents actually ignore until they are told is the stunted growth. If you measure your child's height with their peers and they're significantly shorter from what their peers look like, I'm not saying that you start comparing your child who's 3 years with a child who's 5 years. No, just compare them with a child who's 3 years. Stunting has been associated with a lot of negative impacts in both physical, cognitive, and even psychosocial and mental well-being. Another warning sign of malnutrition that I actually see in a lot of these groups is frequent infections and illnesses. Like a mother always posting that their baby is having diarrhea, they're always having colds, they're always having skin issues. Any small infection here and there, the baby gets it. And unfortunately, you see most moms or most caregivers do not want to be met with the truth, so they actually bash you as being unreasonable when you tell them that the baby might be suffering from malnutrition. You know, you might be giving your baby a lot of food and you're not combining those foods well, you're not taking care of their mediums, you're not taking care of the interaction, so they might not be able to utilize that food. So do not get offended when someone tells you that your baby might be malnourished or they might be struggling with malnutrition. That is why they get frequent infections and illnesses, because their immune system is compromised due to limited supply of nourishment and nutrients. Another common sign of malnutrition that parents ignore is basically the change in skin or hair colors. I'm sure you have met most of your relatives, if not all. If you are genetic makeup, you don't have blonde hair, you don't have really thin in hair and such, and then your baby all of a sudden maybe they had darker hair and then they started changing the colors of their hair. They might change if that is in their genetic makeup, but if it is not, it can be a sign of malnutrition. Another thing on the skin, as Africans, we have dark skins. Even if you're light, you're supposed to be having some shades of melanin. Let's say you're a highly melanin queen and your baby all of a sudden starts changing color and they start moving towards the lighter shade, and you and the dad and even your entire community is like darkly pigmented, then that can be a sign of malnutrition. There's this crazy thing that people think that lighter babies are cute. I don't know, it's personal preferences for many, so I cannot judge. But please, if you start noticing that your baby's skin and hair appearances are changing, you need to actually raise that alarm and talk to your dietitian or your healthcare provider about your concerns. Do not ignore such. Another very common sign of malnutrition is basically the swollen abdomen or even the edema in your hands. This basically can indicate the protein energy malnutrition that we normally refer to as kwashiorkor or marasmus, and this can be life-threatening if not managed. So if you have a baby that has all that signs, like their hair is pale, they have the extended stomach, they have the swollen limbs, pale eyes, all those physical signs of malnutrition, you need to go and bring that child to a dietitian and a registered one for that matter, for assessment and management to correct the impact of malnutrition. So how can you do that? So the first thing that I'm going to talk about is the importance of a varied and balanced diet. I've talked about varied because we have different types of food groups, and unfortunately we limit our babies to take only like a specific like 3 or 4, which is very, very unfortunate. We have grains, we have tubers, we have dairy, we have vegetables, we have fruits, legumes, we have cereals, all those. In all these food groups we also have different types of foods. Like for the tubers we have potatoes, we have sweet potatoes, arrowroot, cassavas and such. And then for the grains we have rice, ugali, chapo, millet like unga uji, wimbi and such. Do not give your baby only one specific type of food or food group, because you will be limiting their intake of the other types of nutrients that are found in other food groups. For instance, potatoes and sweet potatoes are both tubers, but you see sweet potatoes have a higher content or a higher amount of fiber compared to the normal potato. Ensure that your baby is also consuming the different macro and micronutrients. We have proteins, we have carbohydrates, we have vitamins, we have fats, and we have minerals. For microbial and gut health, variety of meals is very, very essential. Another thing is to ensure that if your baby is below 2 years, that you continue with breastfeeding together with the complementary feeds. The benefits of breast milk to an infant or to a growing baby cannot be ignored, because they just promote your baby's health and nutrition status, and you will limit the hospital visits because of frequent infections. In this particular video right here, I talked about how to effectively plan and start on complementary feeding after the 6 months of life, so ensure that you check it out after this. It is well detailed. Another thing that you should do is make sure that you plan for regular checkups. Most of us after the 18th month, that is the 18th jab, we stop or we cease going to clinics with our babies, because now we are tired. We are no longer going to queue for those numbers in the public hospitals, because we are done with immunization and vaccination. I am not disputing in any way the importance of immunization and vaccination, but there are other things like supplementation and deworming that should actually continue up to 5 years of life. When you have a sit down with a dietitian, they're going to assess their eye health for vitamin A deficiency, skin health, hair health. There are so many things that actually go on in the child welfare clinics. It doesn't hurt. It's only like 1 hour, 2 hours max, and you're done. Another thing that you can actually do to reduce the effects of malnutrition is supplementation when necessary. As I have said, when you have a sit down with a dietitian, they can actually talk to you about the importance of understanding the different meal combination, meal preparation, and even meal selections to promote nutrient availability, utilization, and absorption to prevent this malnutrition defect. Another thing, if on assessment your dietitian actually sees that your baby is actually struggling or at risk of malnutrition, despite the fact that you have adjusted their dietary patterns, they might actually recommend a multivit or supplementation that will actually take care of the reduced intake. The only problem I have with moms and supplementation is that they think that they can actually replace the diet. A supplement supplements a healthy diet, just like the word. It is meant to support, not replace. So you might just be wasting your time, effort, and money. So before you do that, have a sit down with a registered professional. And one last thing that you need to do is to make sure that you treat the underlying infections like diarrhea, pneumonia. While you're treating that, also make sure that you're taking care of the nutrient-drug interactions, nutrient-nutrient interactions. And while at it, please let's avoid consuming information on child nutrition and health just from anyone, because some people just don't even care about the well-being of your baby. They just want the likes, so they'll tell you anything. So as a mom, if you're struggling with malnutrition, please, if you are in Kenya, we have nutrition professionals in all the public hospitals, so make sure that you go there, book an appointment, have a sit down with one and talk about the well-being of your child. If you can't afford the private coaching sessions or the private facilities, then also go and actually seek for one. At Mumina Wellness Solutions, I have a child nutrition and healthcare package that actually takes care of the assessing your child's nutritional needs. It also takes care of assessing supplementation needs, dietary planning and meal planning. It also takes care of management of allergies, intolerances, and any other conditions that your child might be having that is related to nutrition. We also talk about nutrition education and counseling to ensure that the parent is well educated on what to do, and if the child is big enough, we also interact with them to ensure that they can actually own the program, so that for effective and better changes. I'll definitely leave the details in the description box, and if you're interested on one-on-one consultations, we also arrange for that. And you need to make sure that you stick around, especially if your baby struggles with allergies and intolerances, because I have a webinar that is upcoming and it is only going for 1,000 Kenyan shillings. I'll definitely link my WhatsApp number there so that you can reach out for registrations and get more details about the webinar, the coaching program and such. And until next time, make sure that you check out this playlist next on child nutrition and health, and let's meet there. Bye.